This is the law right now without Prop 139. And Arizona law also protects doctors and women in late-term crisis complications. Arizona Attorney General Chris Mays affirmed this in June when she assured doctors that they are to care for women at the mere threat of an infection or a crisis complication. She stated, and it's right here, she stated, nothing in the law requires the treating physician to delay providing an abortion until the patient is in sepsis, hemorrhaging, or otherwise at death's door. These are her words. They completely debunk the false claims being perpetrated by proponents of Prop 139, who are trying to manipulate voters into supporting an unnecessary and extreme abortion amendment. These are not opinions. These are facts grounded in the law and in the words of our own Attorney General. And I encourage the news media to not be part of perpetuating proven lies. Whether you support abortion or not, abortion is legal in Arizona up to 15 weeks and beyond that for medical emergencies. Miscarriage treatment and also treatment for late-term crisis complications is already protected under Arizona law. So the three reasons that proponents give for supporting Prop 139 are all false, and voters deserve to know this. We will be hearing now from our speakers, and then we will take questions afterwards. We're going to start with Dr. Erica Crowley.
Hello, my name is Dr. Erica Kreller, and I am an OBGYN currently practicing in Gilbert. I'm also a founding member of Arizona Physicians Against Prop 139. Recently, there have been some heartbreaking stories told by patients who claim that they've been harmed by our current laws. These women and couples were abandoned by their doctors, and I, as a physician, am shocked that such abandonment took place, especially when Arizona law protected their doctors' ability to care for their patients. These women deserved better care. I have cared for patients in these seemingly hopeless circumstances. I have been there when a mother's cervix fails to keep her baby safely inside the uterus, and I have sat by her side to be with her as her child's heart stops beating after being born too early. I have walked with couples whose babies face conditions they can't survive. I have helped them through the grief of diagnosis and the uncertainty of the time left with their babies. I have stood with these mothers and fathers when they can't imagine having a baby and saying goodbye to him in the same day. And we have walked through it together. I have witnessed the joy in the room when the brothers and sisters of my patient, born with unsurvivable trisomy 13, sing her happy birthday and ensure that every last moment on earth is filled with comfort and peace. I have never abandoned a patient, and I have never feared prosecution under Arizona law. I have also witnessed the ravages of late-term abortions. I have cared for a patient who had a second trimester abortion here at a Phoenix clinic at 17 weeks gestation, an abortion that was illegal and performed anyway. And I shepherded her through months of treatment for physical and mental health damage she suffered. I had treated infections that threatened a mother's future fertility and left her with chronic pain after a legal abortion in Arizona. We, the physicians of Arizona, are here to say that the women of Arizona, our patients, deserve more than Prop 139. They deserve care from doctors who can recognize their complications, not healthcare practitioners who point them to online abortion pills and abandon them when they need help most. They deserve what current Arizona law allows me to provide: safe, compassionate care for miscarriages and ectopic pregnancies, safe, compassionate care for patients facing heartbreaking diagnoses, safe, compassionate care for second and third trimester complications that threaten the health of my patients. Prop 139 is dangerous, and its provisions are severely out of step with the way we Arizona physicians practice medicine. I urge you to join us in voting no on Prop 139. Thank you.
Good afternoon. My name is Dr. Larissa Meyer, and I am a board-certified family practice physician working in women's health and urgent care. Prop 139 is not good health care, period. If I were to write an amendment which guarantees health care, I would want it to be as specific as possible in what it included and what would constitute poor care. Prop 139 has vague language that allows for broad interpretations, none of which are good for women. Prop 139 clearly states that the right to have an abortion is more important than making that procedure safe. Working with pregnant women, I have found that the due date from the ultrasound is quite often different from what the patient expected. Prop 139 eliminates the guideline of performing an ultrasound for dating a pregnancy, which is critical in determining whether she can safely receive abortion pills. Working with pregnant patients in the urgent care, I have referred women to the ER for possible life-threatening ectopic pregnancies. Prop 139 eliminates the guideline of performing the ultrasound to rule out ectopic pregnancies before dispensing the abortion pills. Currently, a doctor's involvement is essential in the decision to have an abortion. Under Prop 139, the doctor is eliminated. Abortion pills would be available to all without the approval of a licensed physician. Instead, anyone labeled a healthcare professional would be able to make that decision. In Arizona, this includes a radiology tech, a massage therapist, and even the school nurse. So according to Prop 139, a woman's decision to have an abortion should be between her and her massage therapist. If this sounds absurd, it's because it is, but it's allowed under Prop 139. Parents, imagine this scenario if 139 passes. Your young daughter is sexually active with the soccer coach. When she gets pregnant, he takes her to the local abortion clinic and she is able to get an abortion without parental consent or knowledge, and the inappropriate relationship continues. Does this sound far-fetched? There's a lawsuit in California involving this same situation. Imagine this situation if Prop 139 passes. A woman is pregnant and her boyfriend or husband decides that he doesn't want this baby. He can get the abortion pills and administer them to the pregnant woman in order to force her to have an abortion. He could physically force her to take them or trick her to take them by telling her they are ibuprofen. Does this sound far-fetched? This is what happened to a young woman I saw. Imagine this next scenario. A woman is being sex trafficked. Her abuser calls into the abortion clinic and obtains abortion pills. No one questions his relationship with the woman because this might be construed as restricting her access to abortion. The abuser would have a free pass to do this because under Prop 139, abortion is a fundamental right, and there should be, quote, no law, regulation, policy, or practice that will deny, restrict, or interfere with that law, end quote. Allowing abortion at all stages of pregnancy while eliminating any safety regulations on the procedure, like Prop 139 proposes, is like removing the brakes from a car and saying that we no longer need guardrails. The current law provides those safety guardrails with regard to abortion, and they're simply there to protect women. Prop 139 would be gravely harmful to women, which is why I am against it. Women deserve better. Thank you.
Good afternoon. I'm Dr. Anthony Levatino, a board-certified obstetrician-gynecologist, and in my career I performed over 1,200 first and second trimester abortions. I am also an attorney. Arizona Proposition 139 is being sold to voters as a way to guarantee that women and their healthcare professionals can make autonomous decisions about abortion with no input or oversight by anyone, including the Arizona State Medical Board. The word doctor intentionally does not appear anywhere in the proposition, and indeed, doctors can be cut out of the process entirely. That is, of course, until the complications occur. It would allow women to obtain abortions from non-physicians, including nurse practitioners, nurse midwives, and physician's assistants, for any reason or no reason at all, up to fetal viability and after viability when, in the language of the proposition, in the good faith judgment of a treating healthcare professional, note not doctor, is necessary to protect the life or physical or mental health of the pregnant individual. The language of the proposition is carefully crafted in vague and general terms with no qualification regarding how severely threatened the patient's physical or mental health must be to justify a post-viability abortion, leaving that determination solely in the hands of a financially interested healthcare professional who may not have the knowledge or skill to treat the known complications of abortion procedures, with no professional oversight whatsoever, will open the door to any and all abortions at any and all gestational ages, up to birth, for any and all reasons. This is the unstated goal of the proposition. Proponents of Prop 139 continually tell voters in news reports and advertisements that women will not get miscarriage care and will have to be at death's door in order to be treated for late-term crisis pregnancy complications without passing an amendment enshrining abortion into the state constitution. This is in direct contrast to the facts as proven in the Arizona statutes that were presented and Attorney General Chris May's determination of the facts. Miscarriage care is protected, as it is explicitly excluded from the definition of abortion. Quote, abortion does not include birth control devices to terminate an ectopic pregnancy or to remove a dead fetus. End quote. There is no state in the country that prohibits removing a dead fetus from a woman's uterus. Arizona AG Myers cited this law and reaffirmed this fact in a guidance memo dated June 27, 2024, barely 3 months ago, at the request of Arizona lawmakers. Mays wrote, thus, if a fetus is no longer living, the procedure to remove it is not an abortion, and physicians need not determine that there is a medical emergency before providing the appropriate medical care. Treatment for late-term crisis pregnancy complications is also protected under Arizona law. AG Mays clarified this fact in the same guidance memo. In it, she affirmed physicians may perform an abortion in these situations at the mere threat of a crisis, seriously risking the woman's health or life. They need not wait for the actual crisis to occur. Mays noted, nothing in the statutory language requires a treating physician to delay providing an abortion as necessary medical care until, for instance, the patient is in sepsis, hemorrhaging, or otherwise at death's door. Requiring a physician to wait until her patient is at death's door would run afoul of the principle that statute should be construed sensibly to avoid reaching an absurd conclusion. Precisely what the ads have rushed to, an absurd conclusion. Personal autonomy and the ability to make one's own health decisions is a wonderful thing and one of the 4 bedrock principles of medical ethics, but it's not the only one. Personal autonomy is not unlimited, especially when it interferes with the rights of others. Every obstetrician knows that he or she has charge of 2 equally important human beings whose welfare must be considered. Current Arizona law allows any woman to seek an abortion up to 15 weeks without restriction and beyond when needed to avoid death or serious bodily injury. Arizona law was carefully crafted to enhance the safety of abortion by requiring, first, either medical or surgical abortion be provided by a qualified physician. pre-abortion ultrasound that is the best determination of gestational age and rules out ectopic pregnancy. Quick side note, I did my abortions in New York State. New York State legalized Roe v. Wade legalized abortion 3 years before Roe v. Wade even arrived at the Supreme Court. I, as an abortionist in New York, could do pretty much anything I wanted. Me and my partners, we always required a pre-abortion ultrasound on all of our patients, which we did free of charge, to make sure that we accurately knew the gestational age of the pregnancy and to rule out an ectopic pregnancy. And Arizona law currently requires a pre-abortion ultrasound for exactly that reason, to enhance the safety of the procedure. A parental consent requirement is in the law, with appropriate judicial bypass when needed to protect minor children. Anyone listening to this, if you have children or grandchildren, if you have daughters or granddaughters, think for a moment, do you really want your 13, 14, or 15-year-old daughter or granddaughter to be able to go to a non-physician and get abortion pills and then be left to their own devices when something happens without your knowledge or consent? That's what we are talking about. Arizona also requires that abortion providers have admitting privileges. Every patient has the right to have their complications treated by a treating physician or a physician designated by the treating physician to provide appropriate care in an emergency. Now, what they're not telling you is that upwards of 1 out of every 20 women who has a medical abortion ends up in an emergency room needing further care. All of these requirements protect women seeking abortions and enhances their safety. All of them would be challenged in the courts if Proposition 139 passes, allowing women to obtain abortion pills from non-physicians by telephone or video chat from out-of-state or even foreign providers who never see or examine that patient to confirm their gestational age and rule out a potentially fatal ectopic pregnancy, and who are not there for that patient when complications occur. Patients will be simply dumped into local emergency rooms when complications arise. And as we've all learned from the 2 heavily publicized cases in Georgia, those complications can be fatal. Women deserve better. Many will be swayed to vote for Prop 139 because they feel strongly that women's health should be protected. I couldn't agree more. In many ways, Prop 139 endangers women in the name of unrestricted abortion and goes way too far. The argument and people care about women and people care about women's health. And I know that many people may be persuaded to vote for Prop 139 because, after all, I'm for women's health. I spent almost 10 years working as a pro-life physician in a tertiary medical center in upstate New York, where the most complicated and difficult pregnancy patients came for care. I saw it all in those 10 years. Cancers, decompensating heart function, decompensating kidney function, severe preeclampsia, blood pressures, one lady 220 over 160. These are medical emergencies. And in almost 10 years of treating those patients, I, in my practice, ended, you could say terminated, hundreds of pregnancies to save women's lives. And in almost 10 years, I never once had to deliberately kill her son or daughter to save her life. The other thing they're not telling you in those late-term complications is that a late, i.e. in this case, what I mean when I say late is a post-viability abortion, takes 3 to 7 days to accomplish. If you have an actual medical emergency, you do not have 3 to 7 days to fool around. You have got to take care of that patient now. If you do have 3 to 7 days to resolve the problem, then you don't have an emergency. Thank you.
Good afternoon. My name is Lydia Vest. I grew up in Arizona and am now a wife and mother raising my own family here. I'm here today to share my story with you. Last fall, I found out I was pregnant with our second child. Everything looked great at my 8-week appointment. At my 12-week appointment, I got up on the table and my midwife was using the Doppler to find the heartbeat. All routine. She was going over and over my belly, struggling to find the heartbeat. So she squeezed me in for an ultrasound quickly just to check everything. She assured me it's probably fine, but just to make sure. And I told myself it would all be okay. But my optimism faded as soon as I looked at the ultrasound. There was no more movement. There was no more heartbeat. The ultrasound had showed that our little one had stopped developing and passed away about a week earlier. I was overcome with shock. I went back into the doctor's office to now discuss miscarriage management. Due to how far along I was, the midwife recommended a DNC to avoid infection. The hospital where my surgery was performed treated me with the utmost care and empathy. I recall watching informative videos prior to my procedure that explicitly stated that I was not undergoing an abortion. I learned also that Arizona law specifically states that miscarriage management is not an abortion. The hospital staff even gave me a small keepsake box of a little quilt, a tiny teddy bear, and a poem to remember my child. Not only this, but before the DNC, they performed another ultrasound at my request because I wanted to be sure that my child has indeed passed. This summer, I began to see claims that without an extreme amendment like Prop 139, women like me were going to die, that we were not going to receive care until it was too late. I was livid. They were blatantly lying to us. Proponents of Prop 139 are twisting stories to scare women in order to further their agenda. And their agenda is unregulated abortion up until birth. But they know if women knew the truth of their agenda, it would fail. So instead, they are exploiting tragedy like mine and preying on our fears. They want to keep us ignorant on facts and use vague language and euphemisms. This is their tactic. If they are lying on this, what more are they lying about? The fact is, miscarriage management is not an abortion. Women do deserve comprehensive and safe medical treatment, and we already have access to it, and nobody is taking it away. Prop 139 will only further harm and exploit women. Hold them accountable for their lies and vote no on Prop 139.
My name is Mayra Rodriguez. I am a former Planned Parenthood director, also known as a whistleblower, after I blew the whistle on deficiencies happening in a center here in Arizona. This proposition removes any restrictions towards these abortions, allowing the stuff that I witnessed happening to happen even more and more dangerously. Mi nombre es Mayra Rodríguez, soy exdirectora de un centro de abortos del estado de Arizona. Durante mi tiempo como directora del centro de abortos, yo reporté las malas praxis del abortista en ese centro. Esta propuesta ha engañado a la gente que habla hispana diciéndoles que no existe el aborto en Arizona cuando está disponible hasta las 15 semanas de gestación, que las mujeres están muriendo sin tener acceso a una pérdida espontánea o un embarazo ectópico cuando no es verdad. Lo que no le están diciendo a la gente hispana es que esta propuesta remueve cualquier protección para la madre y su hijo y una menor de edad. La propuesta 139 va demasiado lejos para Arizona. No importa si ves el aborto o no como una opción. El aborto a los 9 meses, sin permiso de los padres, solo abre la puerta a más tráfico humano. Gracias.
Hello, my name is Eric Jones, and I pastor Evident Life Church in Gilbert, Arizona. But I'm also here standing on behalf of Arizona Pro-Life Pastors, which is a coalition of over 750 Arizona Christian pastors from all denominations that have come together in defense of voiceless children and vulnerable women as we strongly oppose Prop 139. Why? Because abortion is not simply a political issue, but is primarily and principally a biblical and a moral issue. God loves life, and he hates abortion. And abortion causes death to innocent, precious babies that God himself is knitting together in their mother's womb, as Psalm 139 so clearly presents to us. So as a Christian, I would like to see no abortions in our state. But in Arizona right now, the law stands that abortions are legal up to 15 weeks. And Prop 139 only extends this ending of human life past 15 weeks, allows for late-term abortions all the way up to birth. The pro-choice lobby, pro-choice politicians, and much of the media are lying about Prop 139. And lying is also something that is a biblical and a moral issue, and God cares about, because lying can also be very detrimental and hurt people, and it's hurting Arizonans even right now. These pro-choice proponents seem to not want any baby to be born in the state in the mother's womb, while removing parental rights and endangering both the child and the pregnant mother. So I stand here today as a pastor, as a Christian, and as an Arizonan in opposition. Prop 139 is opposed to the heart of God. It's opposed to the biblical narrative that uplifts life, and it's wrong for Arizona. So I, along with over 750 other pastors in the state of Arizona, urge every Arizonan to vote no on Prop 139. Thank you.
Hello, my name is Lori Z. Gray, and I'm on the board of Arizona Right to Life. And I was lied to. I want to thank you all for organizing, attending, and watching this press conference. Because women like me have been lied to, shut down, shushed, and set aside. The abortion industry is indeed an industry. Probably an industry guilty of perpetuating one of the largest human rights abominations since slavery. Voters deserve to know the truth. Women and girls will be harmed if Proposition 139 is enacted. I know. I was harmed by an abortion with no significant safety precautions available. Back then, you didn't need parental consent. I was alone when I had a late-term abortion that destroyed my cervix, leaving me unable to have children. Not to mention the physical, mental, and spiritual anguish that abortion causes. I really could have used my parents' advice. A qualified medical doctor would have been nice too. Our girls and women face these risks with no medical doctor oversight over Proposition 139. But instead of giving voters all the information, proponents are trying to scare voters with false claims of a ban that doesn't exist, and lying to voters about miscarriages and late-term complication care that is already protected in Arizona law. They don't want voters to know the real risk of expanding abortion throughout pregnancy while removing the medical doctor and basic common sense safety precautions. Our daughters, our mothers, our sisters deserve better. The voters of Arizona deserve better. They deserve to know the truth.
I think we'll open up to questions now. Just let me know who you have a question for. Yes.
The question is, yeah, you keep hearing the ads talking, and you're hearing from doctors who say they are afraid that they'll go to jail for performing abortions under those circumstances, and even the
Well, in those cases, I would say the problem's not the law because they're already protected under the law. The problem might be that the lack of education, and it's up to doctors to be informed. And I think that's part of what Attorney General Chris Mays did back in June when she wrote that clarification. Do any of the doctors have anything else you want to add?
I teach medical students. And when I talk about this topic with medical students, I make it very clear, the great cry, abortion is health care. Okay, I'll accept that on some level, but it's not the same as an appendectomy or a tonsillectomy. There are no laws about appendectomies and tonsillectomies. There are plenty of laws about abortion, and there's a reason for it. Physicians who are engaged in abortion really need to know what the laws of their state are. And if they don't, that's their own failing. And if they don't know that, and then they're willing to be used by this campaign and get on and do an ad saying, oh, I'm afraid, then shame on them.
Can I ask you a follow-up to that, sir? Hi, my name is Stacy Bartender with the Arizona Republic newspaper. You talk about the need for laws specifically on abortion, and several of your fellow doctors have talked about the ultrasound requirement at least 24 hours before. I want to ask you about something that the pro-Prop 139 campaign talks a lot about, which is that doctors don't need laws to tell them to provide an ultrasound, that because of your training, you would provide that regardless if it's in the patient's best interest. Can you just address that? Is that true?
Are the doctors suggesting that every one of them that does abortion does an ultrasound? I don't know if that's true or not. I did. As I said, in New York, I could do anything I wanted. But we always got an ultrasound because it increased the safety to our patients. It protected the patient. And frankly, it protected me too. Look, I did an ultrasound. Here it is. This is what I saw. The other thing in New York that I could do, I had every right, legally, in New York, protected, to do an abortion on a 13-year-old without mom and dad knowing. Believe me, I was a dedicated pro-abortion physician. I was pro-choice. But my partners and I never, ever would touch a minor without parental knowledge and consent. Because I don't want to be in a position of doing an abortion on a minor, mom and dad has no idea, and then all of a sudden I have to call mom and dad to get permission to take care of a serious complication. That's insane.
I think the difference here is that Dr. Levatino is a physician who knows what needs to be done. And we're seeing in states where it's taken out of the hands of the physicians that people who are taking over abortion care don't know, or they don't care, or they're told they're incompletely trained. They don't have the knowledge or the abilities to accept the complication risks or to even know what needs to happen in order to avoid those. And so we're seeing this in other states where this has been taken out of the hands of physicians. And so that's what we're worried about. If physicians aren't in charge, then women get hurt because people are incompletely educated and don't have the right judgment.
I have a question for Cindy. I'm Sejal with the Associated Press. If this measure passes, can you talk a little bit about the specific legal recourse you're looking to take?
We are totally focused on educating voters right now on just how far Prop 139 goes, and we are not looking ahead beyond that. Right now, we are looking at defeating Prop 139 next week, and our sole focus is trying to reach every voter that we can to make sure that they can cast an informed vote and that they know that this is not abortion just up to viability, but throughout the pregnancy for virtually any reason, and that they will lose those common sense safety precautions that are in place right now. And Stacy, you mentioned the ultrasound. The ultrasound is a very critical safety precaution that we have in place. And right now, every girl or woman in Arizona who does get an abortion will get an ultrasound. They're guaranteed to get that ultrasound. And if they take the abortion pill without getting that ultrasound and they have an ectopic pregnancy, it could kill them. And if they do not get an ultrasound after taking the abortion pill and there are still fetal remains in the uterus, that also could kill them. So it's a very critical safety precaution in place. And the attorney for the proponents of Prop 139 has already acknowledged that required ultrasound will not stand under Prop 139, along with other safety precautions.
So is that specific measure something that the opponents to the ballot measure will be going to court over? That specific restriction?
We have not looked beyond November 5th, and that's what we're focused on now.
Cindy, may I ask you a politics question? I'm curious, I was looking at the campaign finance reports on this ballot measure before I came over here. The pro side has raised and is likely to spend roughly $35 million. This side, your latest reports show like $1.5 million. Wonder if you could talk about what does that signal, and talk to me about what you're hearing from donors when you ask them to contribute.
Well, I would say it doesn't cost a lot to tell the truth, but proponents are spending an awful lot of money right now on TV ads and otherwise to perpetuate these lies that we're talking about and countering and correcting right here today.
Money's from out of state. The money's from out of state.
Yes. I would make that point too, that yes, the top 3 donors for proponents of Prop 139 are not only out of state, but they're national organizations and labor unions. So it's money coming in from all over the country. Anything else? All right, thank you very much. Thanks for coming. Appreciate it. Thank you so much.